Okay, here we have the arterial blood supply to the brain. You've got kind of an overall picture of the brain on the left here, and then you've got the circle of Willis. You have Willis, the little guy here, and so it's a way to try to remember that. Let's look at the overall. You've got the heart here, and you've got the aorta, and off the aorta you have the subclavian arteries, the right and the left. And the right, you're going to see the vertebral come off of it, and also the common carotids. Now, the common carotid, the left common carotid comes right off of the aorta. So that then branches off to the internal and external carotids. But over on the subclavian, it only takes a vertebral. So if you want to contrast into the vertebral and the carotids, or the internal carotid, you want to do it off the left or the right subclavian. So keep those things in mind. The vertebral comes up, and you're going to get into the circle of Willis, and you're going to do the basilar artery. But the internal carotid goes straight up, and that's where you're going to get the anterior and middle cerebral arteries come off of there. And so you've got the medulla here, the pons, the midbrain, the carotids are right here, internal carotids. You've got the anterior cerebral artery, and off of that you've got the medial striate. It's kind of hard to see here, medial striate. You have a lateral striate right here, which I'm afraid isn't listed. Lateral striate right here. Then you've got an anterior choroidal. So those might come in to any question on anatomy or something to that effect, but you want to know where the anterior cerebral, the middle cerebral artery comes off of, and where the vertebral comes up into the basilar artery, and then it goes to the posterior cerebral, or PCA. And we're going to get into that in a second. So aorta, subclavian, vertebral, common carotid, external carotid, internal carotid, vertebral, and where it goes up into the brain. Over here you've got Willis. Now Willis is here, and you've got the vertebral arteries that come up, and they basically come on to the basilar artery at the pons. You do have an inferior spinal artery that comes down off the vertebral artery, and you also have the posterior inferior cerebellar artery comes off the vertebral artery, and then the anterior inferior cerebral artery. The basilar comes up, and you've got the posterior communicating. The reason it's in little dashes is it can go either way. Blood flow can go either way, and that helps with if anything gets occluded. The brain's kind of smart, and it says we might need blood flow either way. You have the superior cerebellar artery here, and then you also have the posterior cerebral artery, PCA. And what comes out between them is cranial nerve 3, so you look at it as like hairy armpits. And if you have some type of occlusion or infarct in this area, you're going to have a problem with cranial nerve 3. Ptosis, and you're going to have problems with down and out cranial nerve 3 with the vision. You've got the mammillary bodies here, pituitary gland, the optic chiasm. You've got those internal carotids that we showed over in the other picture. Off of there is the middle cerebral artery and the anterior cerebral artery. You've got an anterior communicating artery that goes between them. And what you're going to look at is if something is occluded, what's going to happen. If the middle cerebral is occluded, it's going to be lower or upper body. If anterior cerebral is occluded, it's going to be lower body. If you've got the posterior cerebral, it's going to be vision problems. And then you've got to go into what happened with pica or anterior inferior cerebellar artery, which we'll go into a little later, but you've got to make sure you know the anatomy of all this and where things go.